Hello, my name is Caldwell, and I'm here tonight to inform you about home birth and persuade you that it is a valid option for your next birth. If you take a look at this picture, this is my wife giving birth to our daughter on February 3rd in the comfort of our living room. And as you can see, home birth can create an atmosphere of peace during the birthing process. But before, we had a previous cesarean section with our twin sons and a natural hospital birth with our third son. So we've had a range of experience when it comes to home birth and other births. And as an informed husband and somebody who's been through the process tonight, I will give you that information. I will persuade you to equate home birth with safety if you are a low-risk woman and remove a bias towards institutional birth. We will go over the fact that home birth is safer than over-intervention, that is safer in the realm of human experience or emotions, and that it is safer than hospital birth for low-risk women. Next slide. Dr. Glantz of the Rochester School of Medicine found that per 25 inductions, 1 or 2 of those were susceptible to cesarean section. The cycle of intervention is one where a woman can go in and get Pitocin and end up having a cesarean section. That is what he is speaking of. Next slide. This may be no big deal to you, but cesareans are major surgery. They can cause infection, bleeding, blood clots, injury to other organs. Oftentimes we think of them as just normal, everyday occurrences, but in all actuality they're not. And home birth removes this danger. Furthermore, home birth is safer in the realm of human experience. What I mean is home birth is safer for the emotional well-being of everybody involved. Hospital birth creates this disparity between mother and child where the child is removed, and home birth leaves the child right there. The Journal of Gynecology states that a mother and her newborn during the first week, if they are separated, it can cause emotional strain for the mother, even though the newborn is not ill. They take the newborn to the nursery. It's not needed. Next slide. Dr. Sarah J. Buckley states, all the natural inclinations that a woman has in her body are subverted by hospital birth. And it's not conducive to the shift that needs to happen emotionally in a woman who needs peace and quiet and to act on her own intuition. Next slide. Home birth creates that intimate environment that the woman needs. Again, Dr. Buckley states that the hormonal physiology of a woman is further disturbed by practices such as induction, the use of painkillers, epidurals, cesarean surgery, and separation of mother and child. What she means by hormonal physiology is the natural hormones that are released during a natural birth without intervention. That would be oxytocin, endorphins, adrenaline, noradrenaline, prolactin, which is the mothering hormone. That mothering hormone is what we talk about that creates the connectedness between mother and child. Next slide. She says that this can be helped by an atmosphere of quiet, dim lighting, conversation, very little. Under such conditions, she can act intuitively and go just with the flow that her body tells her to go with. She goes with her genetic and hormonal blueprint. Home birth creates that environment. So it is safer for low-risk women. Next slide. The British Medical Journal states that individual rates of medical intervention for home births were consistently less than half than those of a hospital birth. And what they mean is that for everyone who intended to have a home birth, whether they had it or not, and everybody that had a hospital birth, the rates for home births were less than half, even if they had to have intervention. So for fetal monitoring, 9.6% in a home birth and 84.3% in a hospital birth. For an episiotomy, where they cut the birth canal, it's 2.1% in a planned home birth and 33% for a hospital birth. Cesarean sections for home birth intended is 3.7%, and for an intended hospital birth is 19%, and vacuum extraction is 0.6%, vice 5.5% for hospital birth. So home birth alleviates the need to even subject yourself to that cycle, as well as the separation anxiety, of which Joseph C. Pierce says can cause mom and infant to be frightened and depressed. Next slide. In conclusion, from the data you can see it's obvious that if you plan a home birth, even if you don't have that home birth, you're less susceptible to that cycle of intervention. A home birth creates that environment in which you are taken care of by nurse midwives, where you can do what your body tells you to do, not what somebody else does. So take action, make informed choices. Do your research. Talk to those who have had previous home births. Speak with a home birth midwife. You'll find her just as informed, if not more, than a doctor. Don't become a victim to some assembly line process. Think for yourself. So in summary, what have we learned today? What have we talked about? We've talked about how home birth is safer than over-intervention, is safer in the realm of human emotions and experience, and is safer for low-risk women than a hospital birth. So do not subject yourself to that endless intervention. God has designed a woman's body to birth by itself in most cases. If and when you're expecting again, make sure that you're not low risk, and if you're not, talk to a midwife and go with the home birth process. As I've shown you, it is much safer and has a lot less intervention than a hospital birth. Thank you for coming tonight. My name is Caldwell.